Today I'm going to show you how I do a negative pressure wound therapy dressing change or a wound vac, but I just want to go over the basics real quick before I show you how I actually do it. So pretty much, let's say this is the wound right here. We're going to drape what's called a peri wound, or the outside of the wound, to the very edge of the wound. Then we're going to put a piece of black foam over the wound, and then we're going to put a piece of drape all over, like everything. So this way it'll create a seal. Then we're going to puncture a hole here, and that leads off to the wound vac. So that's where the drainage goes, and then the drainage comes from the wound, it goes in there. Then you have it helps the wound, so it takes out the drainage, and then the vacuum creates here for like extra blood flow, and it gets the nutrients and all that good stuff. So this is pretty much what it is. So first drape to the peri wound, then the black foam, then the outside layer to the whole thing. And like I said, I'm a nurse, but this is for entertainment purposes only. Alright guys, so here I'm taking off the previous wound vac dressing or negative pressure dressing. Obviously we're going to do the hand washing and the donning of the gloves and the patient identifiers and all that good stuff. So here you see how the only thing touching the base of the wound is foam. It can only be the foam, because if the foam touches anything else, like the peri wound, it will macerate it, which means pretty much just get it wet, and it'll get really weak, and it can sometimes break down on you. So after you measure it and you clean the wound, make sure you have a sterile area and things like that. You start to cut your wound vac drape, which is going to be the first step. So there's a few ways you can do this. You can either outline the wound and cut it so it kind of lands perfectly, but with all the wounds that I encounter, I kind of just I cut off these little strips, and then on these strips I cut over them, and I'll show you right now. So here, as I'm cutting, so one of the very first step before you put the drape on the wound is you want to put what's called a skin prep or shirt prep around the peri wound. And then so here, whenever you start to put the drape around it, so the green lines indicate like kind of a landmark. It kind of helps you out. So I kind of just eyeball it to see where the wound is, and then I'll cut where I think the edges are going to be. So then this drape is double-sided, so it has protective layers on both sides. So you take out the first one, which it'll have a number 1 on it, and then you place it. So you very carefully put it around the wound. You make sure that all the peri wound is draped. And then so on the other side, there's the second part to the double-sided drape covering, and so it's labeled number 2, and so you cut that off, or you not cut that off, but you take it off. So once you put the first piece on and it's sticking, and you take off both sides of the layer, then you can move on to your next part. And so that's pretty much the first layer. So you just work your way around the whole wound. I try not to waste any of the drape, because it always comes in handy for other parts that sometimes are leaking. So I'll just cut around, and any excess I'll cut off and try to save so I can have for the next part. And also too, on these wounds here, So typically when you do a wound vac, it's for a much deeper wound. This wound is a fake wound. It's on my wife's leg, and so it's, as you can see, it's very superficial. But yeah, typically with wound vacs, you try to, or it's prescribed for patients that have very deep wounds that are otherwise going to take a longer time to heal. So after the first round of drape, then it's the black foam. So the black foam, you cut around. So I get like a bigger piece and I kind of eyeball it. All you really need is for the foam to cover all of the wound base. It doesn't have to be perfect, but it has to cover the whole wound base, and it has to be thick enough for the sponge to absorb the drainage. So once I get more or less the black foam where I need it to be, then we start to put the last piece of drape. And this last piece of drape has to be big enough to cover the black foam and to make a good seal around all the edges. Because what happens is if you don't get a good seal, the machine will let you know. And just as a disclaimer, wound vacs can be dangerous, especially if you put it around like the abdomen or the heart area. So yeah, just be careful when you're doing wound vacs around those areas. So here is the final piece of drape that I just put on. I'm taking the excess off. And so as it sits, it's the peri wound and then the black foam, and then this is the final piece of drape. And so right now it's completely sealed. So in order for us to get the suction out of there, we have to puncture a hole so this tube can suck the drainage out of it. So I think recommendation is a quarter-sized hole, but I don't do it that big because I don't want the there to lose any suction. But you can't do it too small because then it's like trying to suck something down a straw. Like if it's too small, then it'll have a hard time. So I just maybe nickel-sized. And then also depending on the wound vac or negative pressure wound therapy machine that you have or dressing that you have, sometimes it'll look big like this and sometimes it'll be smaller. And so that's pretty much it. After this part right here, you connect that other end to the machine. You turn on the machine and it has a pressure setting, usually measured in millimeters of mercury, I believe. All right, guys. Well, thanks for watching the video. Please feel free to hit the like button if you found the video informative. Please feel free to subscribe if you want more nursing related content. If you have any questions, please comment down below. And if you want to see anything nursing related, just let me know.